My name is Dr. Laura Robotham, and I'm a medical resident at Kearney Hospital in Massachusetts. Today, I'm presenting some information that we've learned from the National Institutes of Health and Centers for Disease Control. Both institutions have excellent websites that I'd encourage you to look at for further information. While I continue learning about what medical care is like for the patient, I want to give you some insight as to the doctor's perspective when you walk into an appointment. I'd like to talk to you about what happens when you walk into your physician's office. So, let's say that you're coming into your doctor for a routine appointment, and you made that appointment to focus on health maintenance. Your doctor wants to help you manage the health conditions that you already have, and then also wants to help you prevent any diseases that might occur in the future. Your doctor might ask you to get laboratory tests, they might give you medications, and they might order imaging tests. Your doctor may also ask you about your diet, sleep, and exercise. One thing that your doctor is trying to understand is how to help you manage and prevent disease based on your risk factors. We are influenced by our environment, by the media, by our culture, and our families in understanding our health. When you see your doctor, they're using scientific information to understand diseases that you might be at risk of developing. This data is all based on scientific studies. And with your participation, you can work with your doctor to reduce your health risks. There are risks all around us. If somebody sneezes nearby, it could increase your risk of catching the flu. Obesity boosts the odds that you'll get diabetes. Smoking increases the risk that you might get many cancers. And if you pay attention to the news headlines, you might worry that you're at risk for food poisoning. You might worry about shark attacks or the Zika infection. And so how do you know which health risks apply to you? Some people, both patients and doctors, don't realize that the environment where they're living isn't necessarily set up to help them make the best decisions about their health, or even to understand what their true health risks are. People's culture, the choices of people around them, their neighborhood, their grocery store, the difficulty for them to get to their doctor's appointments, all these things can influence their health in different ways. As a new doctor, I want you to know that I'm learning about why that is the case, both from you during the appointment and from scientific and public health data. Doctors make sure that they're up to date on all the best medical information. Know that I'm getting more data as part of our societal goal to make sure that we're studying everyone and not just a small part of the population. Your doctor focuses on health risks during your appointments. Knowing the risks you and your family may face can help you find ways to avoid health problems. It can also keep you from being worried about unlikely threats. Knowing the risks and benefits of medical treatment can help you and your doctor make informed decisions. Making sure that everyone has access to the information about risks to health is important to helping everyone in our population, no matter what language they speak or where they live. We want everyone to be able to make smart choices based on facts. A health risk is the chance or likelihood that something will harm or otherwise affect your health. Risk doesn't mean that something bad will definitely happen. It's just a possibility. Several characteristics, called risk factors, affect whether your health risks are high or low. Your health risk factors include your age, gender, family health history, lifestyle, and more. Some risk factors can't be changed, such as your genetics or ethnicity. Others are within your control, like your diet, physical activity, and whether you wear a seatbelt. When you see health statistics, consider the types of people being described. If they're not similar to you, or if the category is very broad, then your risks might be different. It's important that we as doctors are studying all sorts of populations in order to better understand what risks our patients have. A general statement like more than half of Americans over the age of 45 will develop heart disease at some point is based on statistical averages across the entire U.S. population. If you're younger than 45, your heart disease risk will generally be much lower, for example. The more risk factors you have, such as smoking, high blood pressure, or diabetes, the greater your risk of heart disease. Exercise and a healthy diet, on the other hand, can make your chance of developing heart disease lower than for most other people. A lot of the things that can influence you in today's society are designed to get you to buy something. There are people who can make money with you purchasing fatty and salty foods. A lot of the things that you see on TV are designed to keep you glued to the screen, which in turn prevents you from having more time for things like healthy cooking and exercise. Most of us live in neighborhoods that were designed the way they are for specific reasons, but they were not necessarily built with the intention to keep their residents as healthy as possible. It's important for you to look out for yourself and prioritize your health. The person who's truly affected by a lack of health and by disease is the patient themselves and their close contacts. We need to wade through this environment of advertisements and commercialization in order to refocus on achieving health. Our perception of risk is not always rational. We sometimes worry over things that are very unlikely, like Ebola in the United States, and we ignore steps that we can do to prevent what's much more likely to harm us, like heart disease or colon cancer. To lead these discussions, doctors must provide encouragement and answers. Our patients need to keep asking good questions, too. It helps if patients come prepared with 3 or 4 big picture questions to ask their doctors about their health. We understand that there are aspects of your health that are more or less difficult for you, but let's work together to improve your chances of better health. You can gain more information about your health and risk factors for diseases like diabetes, cardiovascular disease, and cancer at trustworthy websites like the NIH website. You can also ask your doctor's office for more information about preventative health. Start by talking to your doctor about your health risks and how you can reduce your risks. This has been Dr. Laura Robotham talking to you about your health and health risks. Let's work together to try to improve your health, because remember that your health is your wealth. Thank you.